Hi, Dr. Fauci. Can we make a short toast?
Got it. Thank you.
We are back again. Thank you, everybody. Let us now continue with the pre-established speakers list according to discussions of the RD and regional director. So I invite Spain to take the floor, followed by Ukraine and Belgium.
Dear Director General, Regional Director, Member States, it's a pleasure for me to participate in this important meeting, and even that underline the leadership of WHO on global and European health policy. Spain has always stood for the main role of WHO on the multilateral response to this crisis. This is why we have support and will continue to support the mandate for both Director Tedros and Kluge. Now it's time to keep on working together, supporting the leadership of WHO in all its fields, especially when it comes to achieve the Sustainable Development Goals, ensuring a healthy life and promoting welfare all across the planet. Spain will be alongside with WHO and the Regional Committee for that purpose. Dear colleagues, when the pandemic started, we didn't have any roadmap. After a year and a half dealing with the virus, we have learned some lessons. I would like to highlight two of them. First, global health emergencies need extraordinary global response. Second, no country and no region will be safe until everybody is safe. That's why Spain is paying attention to open discussion within the working group on strengthening WHO preparing a response to health emergency. When it comes to the second lesson learned I mentioned, I think it's important for us to reflect. There are countries in the European region and that are leading the global vaccination, such as Spain, but there are many regions and countries where the immunization rates are extremely low. We are committed to diminish to the cleavage between the global north and the global south. Spain is delivering. Our President, Pedro Sánchez, announced some months ago our commitment to donate more than 22 million vaccines during 2021. And we have already delivered more than 6 million doses to COVAX, doses that are already arriving to Latin America. I would like to finish my words by expressing how proud I feel about Spanish candidacy for the Standing Committee. Spain wants to make a stronger contribution to the WHO Euro governance, and I am sure Dr. Amos Garcia Rojas could do it greater, because we want to promote multilateralism and we stand for public health in Europe and all over the world, because we are stronger together. Thank you very much.
Thank you. And now Ukraine will have the floor, followed by Belgium and Republic of San Marino.
Шановний генеральний директоре Всесвітньої організації охорони здоров'я. Шановний
General and Regional Director of the World Health Organization. Your Excellencies and dear colleagues. It's a great pleasure for me to have an opportunity to join the 71st session of the WHO's Regional Committee for Europe. Ukraine has always been and will be a supporter and a partner of the WHO policies aimed to protect and promote equitable access to healthcare. It is difficult to overestimate the role of the WHO in coordinating the efforts to combat COVID-19 pandemic. From an early beginning, our response to COVID-19 pandemic has been developed and implemented in line with the WHO recommendations. The WHO guidelines have formed the basis of national policies for the deployment of anti-epidemic measures and healthcare standards. During the fight against COVID-19, we managed to significantly increase the capacity of our surveillance system and laboratory system, develop new sanitary and epidemiological standards in all medical institutions. And most importantly, Ukraine is running successfully the vaccination campaign by increasing the percentage of vaccinated citizens in the country and adhering to the strategy of the global and European regional vaccination plans, making them the basis of the National Immunization Development Strategy. I am confident that our problems, challenges, and lessons learned resonate with the delegations of many countries. New virus requires new measures, including constant monitoring, development of a surveillance system, and continuous training of medical personnel. In addition, I cannot but emphasize many challenges that Ukraine is facing nowadays, including the illegal annexation of the Crimean Peninsula and ongoing armed aggression from Russian Federation in the eastern Ukraine. This has negative economic, social, and most importantly, tangible consequences for health. Nonetheless, we continue to build up our healthcare reform at all levels, and it remains a high priority for the ministry. Currently, my task as the minister to unite everyone on the development of the health development strategy until 2030, with emphasis on the universal access to public healthcare in line with the UN Sustainable Development Goals with WHO principles. I would like to ensure you that our current Health Development Strategy 2030 will build upon international best practices and will fully comply and will prove once again that Ukraine is a valuable representative of the world's community and a supporter of WHO's ideology and principles. In conclusion, I would just like to express my special gratitude for selection of Ukraine as a priority country for the WHO Special Initiative for Mental Health for 2019 to 2023. A joint draft of Mental Health Action Plan has already been developed with the teams of the WHO Country Office in Ukraine and Ukrainian-Swiss Project Mental Health for Ukraine. We are actively cooperating in the field of training of our medical workers, in particular primary care physician, on the issue of early diagnosis and mental health disorders. I would like to take this opportunity to express my deepest gratitude to the WHO Regional Office for Europe, Dr. Hans Kluge, for his steadfast support and cooperation in many areas, including the fight against COVID-19 and good access to vaccines. Ukraine will continue to fully support the WHO and its activities as we are and will be a part of the international team, because only together we can defeat COVID-19, improve health, and move closer to sustainable development goals for health and well-being. Thank you all for your attention.
Thank you. And now Belgium will take the floor, followed by Republic of San Marino and Poland.
Dear Director General, Regional Director, dear colleagues, Belgium fully aligns itself to the statement made by Slovenia on behalf of the EU and its member states. Firstly, I would like to thank the entire WHO staff and especially both your Director General and your Regional Director for your unwavering support during the COVID-19 crisis. The most pressing challenge we face today, undoubtedly, is to vaccinate all our populations all over the world. Epidemiological models foresee a fourth wave of COVID-19 infections in the next few months, meaning a possibly significant new wave of hospitalizations, mainly among the non-vaccinated. And it's evident that we have to continue to work on reducing vaccine hesitancy and drastically improve access to vaccines. If we fail to do so, the human and social cost will once again be enormous. And therefore, medical countermeasures during a pandemic, like COVID vaccines, should be a kind of global public good. This is simply in the interest of us all. And international cooperation and solidarity will be paramount to achieve this. My country is committed to international solidarity. We have provided COVAX with financial resources and at least 4 million vaccines this year. With regard to the booster shots, we are strictly following an evidence-based approach. And this means that we are limiting the use of a booster at this stage in a very well targeted way to only those vulnerable populations for which there is clear scientific evidence today. And we call on other countries to follow the same approach. Finally, as part of Team Europe, Belgium is directly contributing to the increase of production capacity for health products in the African region. A pandemic treaty should be serious on international solidarity as well. It should guarantee that in the future we will not be confronted again with the unacceptable inequities in access to medical countermeasures, including vaccines. Based on our engagement in the Oslo Medicines Initiative on pharmaceutical pricing, we are ready to play an active role in order to find ways to structurally address this issue. Dear colleagues, we need to prepare for the next pandemic. We cannot wait until the current crisis is under control to do that. We believe that together we can achieve more. And that is why we believe in strengthened and intensified cooperation between the EU and WHO Euro. And that is why Belgium is actively engaged as a chair in the subgroup on the WHO's work at the country level. Indeed, we are convinced that all countries can benefit from WHO support, rich and poor countries alike, all countries, independent from their income level. And with this in mind, I'm happy to let you know that our updated country cooperation strategy provides for further intensified cooperation between WHO Euro and Belgium. Thank you for your attention.
Thank you. And now Republic of San Marino will take the floor, followed by Poland and United Kingdom.
Dear Regional Director, Excellencies, distinguished delegate, colleagues, I take this opportunity to point out how much COVID-19 is showing over time the unpreparedness of Western countries in containing a pandemic. As is well known, San Marino carried out a profitable vaccination campaign exceeding 77% of vaccinated people in a few weeks, with great efforts and thanks also to the Sputnik vaccine, necessary to cope with delays of more than 2 months in the delivery of vaccines approved by EMA. We did not know that regarding COVID in Europe, we will be faced with Series A and Series B vaccines. We could not imagine that it will be the brand of the vaccine, not its effectiveness, that will determine freedom of movement. Who among you has ever made distinction about the brand of the flu vaccine? Why, in this case, does all this happen? In this way, Europe punished those who have been vaccinated with the wrong vaccine and pushes ever larger section of the population not to get vaccinated. The citizen of San Marino, immunized, vaccinated and masked in a country that for over 6 months has not recorded deaths or hospitalization in ECU, are compared to not vaccinated people outside our borders. The WHO has a duty to remedy this dynamic that punishes poor countries which will not be able to afford the costs of vaccination campaigns based on increasingly expensive vaccine, and those have been forced to access to the market to overcome delays in European countries. Austria has established that for the purpose of entry into their country, certification of possession of antibodies against COVID is equivalent to a certificate of recovery. San Marino has done the same since last May. As I have already argued for at least 6 months, even in the meeting of the WHO, this is the most correct and democratic way to pursue, because science cannot be bent to economic interests, and antibodies obtained with Pfizer, with Sputnik or with a contagion make no distinction and are perhaps the only criterion that can guarantee coverage. Because we know that there are many vaccinated people who do not develop antibodies. I ask the European Union, whose values we also refer to in the context of association negotiation, to evaluate my suggestion, and that in the next WHO World Meeting we will consider and vote on a resolution on the Green Pass and free movement that also includes the certification of possession of antibodies, and that this certification can be considered equivalent to a certificate of recovery. I conclude with a question. What will happen if the individual states decide that vaccinated subjects or those presenting antibodies should be considered recovered? In conclusion, while expressing this wish and hoping that many countries will share this position, I wish to renew my thanks to Dr. Kluge, WHO and WHO Europe. Thank you for your attention.
Thank you, and I invite Poland to take the floor, followed by UK and Slovakia.
Thank you very much, Madam President. Director General Dr. Tedros, Regional Director Dr. Kluge, colleagues. Poland fully aligns itself with the statement delivered by Slovenia on behalf of the EU and its member states. To start with, I would like to express our appreciation for WHO's tireless efforts in combating COVID-19 pandemic, both at global and regional levels. Global solidarity in the fight against COVID-19 is the key to ending the pandemic and keeping the healthcare systems resilient. We are strong only together and united in actions. Current crisis is not over yet. We have vaccines, but we still need to develop efficient therapy. Vaccination programs started in most, if not all, countries of the region, yet the access to vaccines is far from being equitable. Poland has already managed to share vaccines allocated to us with countries in the region, but also beyond it. We will continue to take part in this joint redistribution effort, which is a shared responsibility of all of us. Pandemic is ongoing, yet there are also other areas we must take care of. That is why Poland welcomes with full appreciation the Mental Health Coalition. Poland's current actions in this field aim at community-based mental health services through our mental health centers. Additionally, soon we are launching a pilot program directed to children and adolescents addicted to digital technologies. I would also like to voice our full support for European Immunization Agenda 2030. Mass vaccination programs are one of the most effective tools in the fight against communicable diseases and in providing universal health coverage. Nevertheless, anti-vaccination movements keep growing stronger and have more and more followers. That is why it is also important to educate people to fight misinformation and infodemic. In this context, I would like to cordially thank Dr. Kluge and his team for organizing a successful workshop on this subject for Polish experts in the end of August. Colleagues, let me conclude with a personal remark. Health is and should continue to be the most important area of public policy and public intervention. Looking back, I can see how much has been achieved. Looking ahead, I can see the challenges that are coming. As this is the last regional committee for me, I would like to thank you for your cooperation and support. It has been a great pleasure and an honor for me to work with you all for the last 10 years. I am sure that the WHO leadership in health at regional level will bring success to future endeavors of all countries of our region. Thank you very much.
Thank you. And now I invite UK to take the floor.
Thank you, Dr. Tedros and Dr. Kluge, for your personal leadership. As we continue to deal with the pandemic, we must also focus on how we build stronger systems to protect against future pandemics, and we therefore welcome the focus of our agenda. Non-communicable diseases remain a significant global threat, and evidence shows that people living with obesity are at greater risk from COVID-19. By taking action to help reduce sugar and calories in food, we will also help address rising rates of obesity and its related diseases, but also increase our resilience to COVID-19. The UK has been working with WHO and is pleased to announce the launch of the WHO Europe Sugar and Calorie Reduction Network in spring 2022. This will facilitate the development of coherent policies and programs to promote sugar and calorie reduction across the region. We will share our lessons in domestic sugar and calorie reduction and work with our international neighbours and the food and drink industry to make their products healthier, considering government action where necessary. Together, we can make a stronger case for multinational companies operating across our region to act faster. Turning now to communicable diseases, during our second virtual regional committee, it is clear we must continue to work closely with WHO and collaborate as member states, sharing best practice, scientific research, and data. But it is also clear that the status quo is not an option. Preventing and responding to future health emergencies requires a commitment to do things differently. The UK therefore believes that a legally binding treaty is essential to achieve real change in the way member states and international organisations prepare, prevent, and respond to pandemics and other health threats. A treaty will complement the existing tools and systems we rely on, including the international health regulations, whilst enabling new mechanisms, including stronger surveillance, a fully One Health approach, and outbreak investigation models. We think it is crucial to use the current momentum to get agreement on the need for a treaty at the upcoming World Health Assembly special session in November. It is important we consider its development as part of the broader reform conversation. We need to continue to progress on other important health, governance and financing questions in parallel. Thank you.
Thank you. And now I invite Slovakia to take the floor.
Honorable Director General, distinguished Regional Director, Excellencies, ladies and gentlemen. First of all, Slovakia would like to thank the Secretariat for the report on COVID-19 lessons learned in the European region. Nowadays, we observe a general acknowledgement of the fact that the pandemic has changed our lives beyond recognition. It has also shown us that efficient tools for countering the pandemic as well as coherent actions were lacking. In order to emerge stronger from this public health crisis, the implementation of international health regulation should be firmly followed. We cannot, however, ignore the need for its fine-tuning in terms of narrowing the scope for its vague interpretation, which should be appropriately reflected in the negotiations on the future pandemic instrument. Moreover, we should be vigilant enough not to create parallel structures while remaining as consistent as possible in shaping this instrument. After having been confronted with uncertainty such dimensions today, nobody can pretend that we can achieve security in isolation, nor to rely exclusively in the probabilities generated by statistical models. This is why each actor should remain committed to contribute and participate in the groundwork for the global cooperation. The pandemic has also exposed as a strong demand for new narratives and reform institutions. In view of this necessity, Slovakia has proposed the initiative on more transparent, inclusive and predictable WHO governance with the aim of sculpting a more comprehensive community as a pillar of international health architecture. In this sense, Slovakia would like to extend its gratitude to Regional Director and his team and various other countries for the support of this initiative. Timely actions in the field of avoiding the spread of the disease require not only swift information exchanges, but also a quality information system closely interlinked with the efficient data sharing. It is equally important not to disregard the burning matters, such as the non-communicable diseases, nor the impact of the pandemic on mental health. In spite of this critical meltdown in the sphere of public health, I remain positive that these challenges has taught as a lessons from which we have much to learn, even more to gain. It is an opportunity for the rethinking current function of health system in order to achieve a more resilient societies. Thank you.
Thank you. Although we still have a number of interventions to go from member states, but also from international partners and non-state actors, we need now to move to the next item. Therefore, I'll suspend item 2 for now. We will come back to it about 5:30 after our session on the Pan-European Commission on Health and Sustainable Development. I open now agenda item 3, COVID-19 lesson learned, getting ready for the next pandemic. This is one of the key items of our agenda. This meeting will draw on the experiences of member states in their response to the pandemic to see how we can further improve our joint emergency preparedness and response for the future. We can see on the screen the relevant documents for this agenda item. As mentioned before, progress reports are thematically clustered to other agenda items. The committee will be invited to note this progress report under item 14 later in our agenda. Before we focus on the situation in our region, it is good to also hear from other parts of the world. First of all, it is my honor and privilege to welcome Dr. Anthony Fauci, Chief Medical Advisor to the President of the United States. Dr. Fauci, thank you for joining us live from Washington. It is such a great pleasure and honor to have you with us. Could I kindly ask you to share with us what are some of the key lessons that you are personally drawing from this global health crisis, but also what lessons the US had learned in terms of the preparedness and response to health emergencies? Dr. Fauci, you have the floor.
Thank you, Madam President and Regional Director Kluge. Dr. Kluge, it has been a pleasure to meet with you twice earlier this year, and I'm honored to be invited to speak to the Euro Regional Committee today. As many of you know, European and United States scientists have helped lead the global effort to discover and evaluate medical countermeasures to address COVID-19. Therefore, let me start by thanking each of you and your governments for continuing to support this fundamentally important pandemic response and preparedness research, both in the past and especially into the future. As for lessons learned, first, COVID-19 has taught us that long-term investments in global disease surveillance and basic biomedical research are essential to identify and prepare for emerging diseases with pandemic potential. I would note sustained research investments over the years prior to the emergence of SARS-CoV-2 enabled the unprecedented pace of COVID-19 vaccine development. Two activities in particular predated successful COVID-19 vaccines: the development of versatile vaccine platforms and the adaptation of structural biology tools to design specific proteins, immunogens that is, that powerfully stimulate the immune system. The discovery of an immunogen adaptable to multiple life-saving COVID-19 vaccines resulted from collaboration across different scientific subspecialties in the United States, in Europe, and elsewhere. Moving forward, all our countries need to commit to the strengthening of emerging diseases surveillance and infectious diseases research capacity. And very importantly, to the open sharing of data and research materials to assure a rapid and informed global action. Second, the pandemic has demonstrated that public support is essential for research success and for the effective uptake of public health and clinical interventions. This is particularly important with communities that are skeptical, disadvantaged, or historically exploited. To build trust, we need to clearly explain why and how public health knowledge and guidance can change as new data accrue through well-designed research. During this pandemic, there's been considerable mistrust. Addressing the causes of this mistrust must be a priority going forward, whether it is caused by a lack of understanding or active disinformation campaigns. Third, the pandemic has reminded us that global cooperation and collaboration are essential in the modern world where national borders no longer restrict population movement. Fortunately, using the tools of modern science and communications, public health officials and scientists can work together more efficiently than ever. Moving forward, we need to take full advantage of these tools, especially to be better prepared to detect and respond to future health threats. And finally, we have learned how valuable public-private cooperation can be as we developed and test vaccines, therapeutics, and diagnostics as quickly as possible. In the United States, Operation Warp Speed and other initiatives enabled such partnerships, and they resulted in an unprecedented timeline for vaccine research and development. As the pandemic recedes, we need to do all we can to keep these partnerships robust. Much has been learned about this novel pathogen and the disease's causes. However, many scientific and public health challenges remain that require political will, robust research, scientific acumen, community engagement, and a commitment of substantial resources, both domestically and globally, to bring this historic pandemic to an end. In all these areas, as you all well know, the multilateral agencies like WHO and Euro have a key role to play as they facilitate our collaborative efforts and remind us of the importance of equity and global well-being. The United States has firmly restated our commitment to WHO, and moving forward, we all need to find ways to strengthen our international organizations, particularly as we work together to be better prepared for future pandemic threats. And so thank you for the opportunity to address you today.
Thank you very much, Dr. Fauci, for your enlightening views. It's very important that we work between regions because it is clear to me that we are facing some of the same challenges and potential solutions. Only with global solidarity and more transatlantic scientific collaboration, we will be able to bring the pandemic under control. Before I let you go, I think our regional director would like to say a few words.
It is so wonderful to see you, Dr. Fauci, at our region committee. And thank you for receiving me so well when I was recently in Washington, D.C. Let me thank you for your global leadership. I was telling you in August that you have many friends in the WHO European region. And thank you to your president for the commitment to WHO. Maybe one point, Dr. Fauci, if you allow me, one of the similar challenges that we are facing transatlantic is the question on vaccine hesitancy and misinformation. In fact, you touched upon this. So we really would appreciate if just maybe for a minute, Dr. Fauci could say something a little bit more about this one, about maybe some advice how we can tackle that big one on the vaccine hesitancy and the misinformation. And thank you so much.
Well, thank you for that very important question, because it is something that has been of considerable concern to us here in the United States. We are fortunate enough to have a supply of vaccine to vaccinate everyone in the United States. Yet, we still today have about 75 million people who are eligible for vaccines who have not been vaccinated. So the idea of hesitancy is a very significant issue. What we have done is that we have tried to outreach to the groups that have been hesitant to accept vaccines, but we've done that by what we call trusted messengers. So although I and many of my colleagues in public health continue to send out the message to get vaccinated, we find it is much more efficient to get trusted messages from the community. They could be religious leaders, entertainment individuals, or sports and community heroes. They are listened to much more readily than official public health people like myself. The other issue is that we have, because of social media, a considerable amount of disinformation and misinformation that spreads widely. The only way we have found to counter misinformation and disinformation is to provide in a very copious way correct information. And we do that through utilizing the social media, things that we never would have felt would be used for public health. Things like Instagram and Facebook and TikTok and things like that. I would have never thought that I would have been involved in that in my life, but in fact, I am because of the utilization of that by so many others. And finally, we have tried our very best to include community members in our clinical trials in order so that they can participate in the research and go out into the community and validate that everything was done in a scientifically and ethically sound manner. So thank you for giving me the opportunity to answer that question.
Thank you, Dr. Fauci, for your valuable advices. We will now release you as you have to attend other urgent matters. Thank you for being with us today and for making time in your busy schedule. Moving to another part of the world, I'm very pleased to welcome the Regional Director of the Eastern Mediterranean region, Dr. Ahmed Al-Mandahari, for a short reflection on how the pandemic has shaken his region and the specific challenges it created. Dr. Al-Mandahari, you have the floor.
Thank you very much, Madam Chairperson. It is really appreciated to give me this privilege, and I'd like to thank my dear brother Hans for giving me this honor to join your excellencies and sharing with you our input as a regional, as a region, which is sharing so many things. It is not just borders with our dear Euro region. It is a pleasure and honor to address the Regional Committee for Europe. Our two regions, as I said, yes, we share borders, but at the same time, we share much more. We share cultures, we share economies, we share history that we cannot forget, as well as we share lives that cross borders with health-related challenges and needs. Furthermore, as you know, Your Excellencies, the Eastern Mediterranean region is the source of around 64% of the world's refugees, which makes it of special interest to everyone. We have excellent cross-border collaboration with our Euro colleagues to manage the crisis, for example, in Afghanistan, in Palestine, and in Syria. We are united under the shared health agenda of GBW13, and collaboration has strengthened further during the COVID-19 pandemic. EMRO, as you know, Your Excellencies, is a complex region of 22 countries with wide diversity in socio-economic status and health systems, almost half of which are experiencing large-scale humanitarian crisis. Managing the pandemic response in that context has presented multiple challenges, but also at the same time, we have many opportunities. We have become more agile, resilient, and collaborative, and health has become the #1 priority for our countries. We have learned that working together with all sectors and communities is the only way to succeed. The pandemic has highlighted the value of comprehensive, all hazards emergency preparedness and response. We are working with countries to strengthen their approach to emergency management, to align it with international standards and best practices with a sustainable multi-sectoral health system perspective. We have achieved notable successes. We have levered our influenza systems and now have over 600 laboratories in our countries with PCR testing capacity. 14 countries have also acquired genomic sequencing capacity, and more will follow. Over 1,200 of our field polio staff were repurposed to support the response. Our Dubai logistic hub has served the global response, dispatching 438 shipments to around 110 countries across the world. But the COVID-19 vaccine rollout has highlighted serious inequities. While several of our wealthier member states have made impressive progress, six countries in the region have fully vaccinated only less than 2% of their population. We have established dedicated teams to support those countries. I have set up various platforms to engage our member states and promote inter-country collaboration. Similarly, and together with my dear friend and brother, Hans, we have now established a platform for bilateral discussion between our two regions. With numerous joint borders, movement of migrants and refugees, and risk of disease spread across borders, we can advance the joint work, including optimizing skills of migrants and refugees and improving collaboration on points of entry. Let me close by acknowledging the generous support of Euro member states, which has been strong partner to our region for many, many years, particularly supporting WHO's preparedness work and humanitarian response in numerous countries in the region, both technically and financially. Such partnerships are invaluable for our collective health security and for protecting and supporting the most vulnerable here in the region. I thank you sincerely and seek your continued invaluable engagement and support to advance our region vision of health for all by all. I thank you, Madam Chairperson. Thank you.
Thank you very much, Dr. Henri, for sharing with us your work, reflections, and thoughts. And now it is also my pleasure to introduce Dr. Matshihido Moeti, Regional Director of the WHO African Region, who will address the Regional Committee through a pre-recorded statement.
Chairperson of the 71st session of the Regional Committee for Europe, WHO Regional Director for Europe, my dear friend and colleague, Dr. Hans Kluge, Excellencies, Honorable Ministers, delegates, and colleagues. I'm very pleased to join you all in this session. Thank you for having invited me. While we are battling COVID-19, we must also prepare better for the next pandemic. Weaknesses have been revealed in health systems of all levels of development, showing that every country should invest more in providing quality care. In the African region, decades-long underinvestment in health systems has left populations incredibly vulnerable. Countries also face a range of other emergencies like cholera and Ebola and humanitarian crises in the Sahel and other places. These external shocks never stop. Building more resilient health systems is therefore a top priority. This goes hand in hand with scaling up local production to safeguard access to essential commodities. Overall, preparedness must be recognized as a key component of national development and security agendas. COVID-19 has reaffirmed that the world is connected with a shared vulnerability, so equity must be at the forefront of our collective efforts. Right now, to stop people from dying of COVID-19, Africa's access to vaccines needs to exponentially improve. Countries have shown that they can get the vaccines into people's arms. Supply shortages remain the major bottleneck. Finally, the pandemic has highlighted that the world needs WHO and that the organization must be adequately funded. I'd like to appreciate the support of the European region, particularly the United Kingdom, Germany, and the European Commission, who are among the top financial contributors to WHO's work in Africa. Together, we are striving to save lives, improve well-being, and serve the vulnerable in response to COVID-19 and other major priorities. Thank you for your attention.
We are grateful for Dr. Moeti's opening statement. Now, let us come to the experience built with this region. Before I give the floor to Dr. Dorit Snitsan, Regional Emergency Director of WHO Europe, We are also very honored to have received a video message from EU Commissioner for Neighbourhood and Enlargement, Mr. Oliver Varhelyi.
Dear participants, it is a pleasure for me to address your panel today. Together, we have come a long way since the outbreak of the COVID-19 pandemic. This pandemic confirmed clearly that we can work together, we can find common solutions, we can rely on each other. This means that we can also recover together and come out of the crisis stronger. Our common efforts help to better understand the virus and its varieties. We have a number of available treatments and measures to fight against infection and illness. But most importantly, we have now vaccines available to stop the pandemic from spreading. It is an important achievement of the scientific community. From the start of the pandemic, the European Commission has stood by its partners in the Western Balkans and the EU's immediate neighborhood. Despite the global shortage, the EU has delivered life-saving equipment and vaccines. First, with emergency medical equipment like masks, ventilators, intensive care units, and ambulance vehicles. Second, by strengthening the resilience of the partner countries. Third, we have helped to secure vaccines, especially for the medical workers, as well as for vulnerable groups. Now, we are helping to launch the socio-economic recovery. We care for our partners. The role of the World Health Organization remains of paramount importance, and let me express our appreciation for your commitment and determination to address the pandemic. Our close cooperation has helped to roll out the vaccination campaigns and ensure the resilience of the healthcare sector across the Western Balkans and in the Eastern Partnership countries. Currently, I see 4 key challenges ahead of us. First, a steady supply of vaccines. In most partner countries, progress is visible, but to stop the pandemic, we must vaccinate more than 80% of the population. We're still far from those levels. EU member states are ready to share vaccines. Please let us know your needs over the coming months, and I will do my best to facilitate the vaccine sharing by our member states to fill the gaps. Second, the absorption capacity for vaccination. We have noticed that not all partners have sufficient capacities to roll out their vaccination strategies. These need to be increased for an efficient vaccination campaign, especially to reach the most vulnerable groups. The support of the WHO for training, planning, and preparedness is much appreciated. Third, fighting vaccine skepticism. More and more partner countries face problems to ensure that a sufficient number of their population get vaccinated. In some cases, even reaching more than 20–30% of the population looks challenging. We remain ready to continue supporting these countries. We need to avoid a vicious circle of continuous waves of infections with high numbers of victims and its socio-economic damages. Fourth, the long-term modernization of the healthcare systems. This pandemic might provide an opportunity to work on the functioning and resilience of our healthcare systems and address some of the long overdue shortcomings. Not only as regards the COVID-19 and other infectious diseases, but also more broadly in terms of the infrastructure, staff, access to treatment and training. Only the vaccine can stop this pandemic. I wish you a good discussion on the European immunization agenda for 2030 and how to build better health for tomorrow. Thank you for your attention.
Thank you, Commissioner Varhelyi. We are so grateful for the solidarity displayed by the Team Europe Action in the context of COVAX, but also more broadly in the support to help strengthening countries' health system resilience across our region. Now, Dr. Nitzan will present the main conclusions drawn from various sources, including interaction reviews, consultation with member states, also including the recommendations from various panels and review committees. Since this is the first presentation that will be shown during this session, let me inform you that the Russian version of all presentations will be made available to you through a separate link that will be communicated to you in the Zoom chat and on the screen too. Dr. Nitzan, you have the floor.
Thank you. Thank you so much, Madam President, distinguished ministers and country representatives. Yeah, I can still remember that ring on my phone at 9 p.m. on the 24th January 2020, announcing the first cases of COVID-19 in our European region. It was a call that we had been expecting and had been preparing for. And yet, it marked the first step of a long journey. We immediately activated our response team and started supporting countries. You can see the timeline and all the information on our website. Almost 20 months ago, and we started that journey, but our learning curve has been unparalleled. Throughout the COVID-19 pandemic, WHO Euro has been supporting member states through in-country deployments and virtual missions and remote trainings by providing expert guidance and advice through the whole house, actually, and the whole WHO, securing access to medical and laboratory supplies, also with and through our operational partners. The support activities can be viewed also on our website. Next, please. Today, we are presenting the lessons learned in order to achieve a European region that is resilient and is able to stand and withstand against health emergencies. They were developed based on an online consultation with member states and partners, recommendation made by global review committees, the discussions that our regional director held during these past 20 months, and he has held a lot of those deliberations, meeting in countries and in-house, lessons learned from the intra-action reviews undertaken by yourselves, midterm report on the action plan to improve public health preparedness and response in the WHO region 2018 to 2023. They also link to the health transformation in the digital age during the COVID-19 pandemic document and is guided by the European Program of Work, the EPW that we all know. Next, please. And if I could summarize our learning in one sentence, it would be that universal health coverage and preparedness of the health systems, other sectors, and communities pay off only if they come together. And this is the recipe for resilience. Let me explain. On one hand, countries with universal health coverage anchored in primary healthcare, as mentioned by our regional director, were more agile and ready to deliver comprehensive, people-centered response. They were ready to immediately integrate core health programs into emergency management. On the other hand, countries where the whole of government and the whole of society